All right, so a lot of you are about to start intern year. Just wanted to send some tips your way as it pertains to pre-rounding. You want to have a system in place so things are efficient, things are smooth. At one attending tell me it takes her 20 minutes, 20 to 30 minutes to go through 14 patients pre-rounding with this system. I've never been able to do that, but this system that I'm about to share with you guys, I think has made things smoother and quicker for me. So the first thing you want to do, you come in the morning, you're pre-rounding on patient one. You want to look at their vitals. What have their vitals been within a 24-hour span? What is their blood pressure looking like? What's their temperature looking like? What's their respiratory rate looking like? What is their oxygen saturation looking like? And depending on what the patient's in there for, you may pay attention to particular vitals. If you are monitoring a fever curve because this patient is coming in looking infectious, maybe they're SIRS positive, what has their temperature been within the 24-hour span? If they're coming in with hypertensive urgency or emergency, have we been able to manage their blood pressures well within the 24-hour span? If they're coming in with acute hypoxic respiratory failure, what is their oxygen saturation looking like and how many liters of oxygen are they using? All of these things are important, and that's the first thing you want to check. The next thing you want to go and check your lab results. If you ordered a Chem 7, a Chem 14, a CBC, what are those things looking like? Any other ancillary labs that you ordered, right? So you suspected this patient had pancreatitis and you ordered a CRP or an ESR to see if they have elevated inflammatory markers. Has that lab result come back and what's it looking like? You ordered a BNP to assess if this patient is truly in volume overload secondary to heart failure. What is that looking like? Whatever it is, check those labs and write down the pertinent ones. Okay, so the next thing that you want to be checking for is your micro data, your microbiology. So did you take any blood cultures when this patient came in? And how have those been over the last 24 to 48 hours? Did you take any sputum cultures, any wound cultures? Are you checking this patient for the influenza, for COVID, stool cultures, stool, ova, and parasite? Like all that micro data, if it's pertinent to your patient, you want to be checking for. After micro, I'm moving into imaging. So did we get a chest x-ray for this patient? Did we get a CT abdomen pelvis for this patient, an MRI brain for this patient? Whatever imaging we got, and again, if it's pertinent, let's find out if the study's been done. Number one, if there's been a preliminary read uploaded, or if there's a final read. Very important. So the next thing I'm moving on to is medications. And when I initially started, I would be going through the entire medication list, writing it down. Takes way too much time. What you want to do is, if you're able to print off a medication list, that's great in terms of like what medications your patient's on inpatient. But what I came to do eventually, which was a lot faster for me, and I'm still a work in progress in terms of efficiency, so I'm not I'm still working on that part, but this really helped me. What I came to do was just start looking at my pertinent medications and I was looking to see if those had been received by the patient. So if they're coming in, let's say for alcohol withdrawal, and we have them basically on a symptom triggered approach of benzodiazepine treatments, we're treating them with Ativan, for example. How much Ativan did they receive overnight? If they are coming in with a sickle cell crisis and they're dealing with a lot of pain, how much oxy did they receive overnight? If we decided to diurese this patient twice a day because they're coming in with a heart failure exacerbation and they have significant volume overload, are they receiving their Lasix? The next thing I'm going to go and look at are the overnight notes from the nurses. And that's going to help to inform my subjective when I'm presenting that portion of the presentation to my attending. And these can be very informative, right? It can tell you that the patient refused medication. It can tell you that the patient ended up having 2 vomiting episodes overnight. There can be a lot of these informative things that can help to guide management and help to inform your presentation. And so notes is what I'm checking next after medications, and that kind of rounds out my pre-rounding process. So again, starting from the top, you want to go and, number one, check your vitals overnight. The second thing you want to do is go and check your lab results. The third thing you want to do is check on your micro data. The fourth thing you want to do is check on any imaging that was done overnight. And if the final reads back, the next thing you want to do is check on your medications. Look at the actual medication list and see if they're receiving the medications you've ordered and they're receiving it appropriately. And the next thing, or the last thing you want to do, is check on overnight notes to see what's been happening with your patient since you left the hospital up until the time you ended up coming back to the hospital. And that should be all the information you need to fully integrate into your SOAP presentation. Nuance MD.